Very good evening to all of you present here. On behalf of the team VIMHANS, I would like to extend a very warm welcome. Thank you for joining us today in the monthly series of our community-oriented mental health initiative. And it gives me an immense pleasure that you're taking out your time and joining us. So, given the topic today, adolescent and depression. So when we talk about pandemic and disruption of school and disruption in interaction with the peers, and the pandemic has left teen with the various mental health challenges, and depression is among one of that. To shed more light on this topic, we have with us our esteemed speaker, Ms. Soumya Jain. Ms. Jain is practicing psychologist at VIMHANS and has done her grad and post-graduation from University of Delhi. And she pursued her MPhil from Institute of Human Behavior and Allied Sciences. And she has been primarily working with adolescent and adults presenting with depression, anxiety and personality disorders. Over to you, ma'am.
Thank you, Disha, for the introduction. Good evening. I welcome you all to today's discussion. Thank you for joining us. So we have been discussing for the last two talks. The series has been focusing on mental health concerns in children and adolescents. Today's talk will be extending it to specifically depression. I'm sure we all agree that it has been a very long 2.5 years for all of us, especially children. It is of no question that with nationwide lockdowns and pandemic-related restrictions, adolescents have borne the brunt of it the most while being away from schools, friends, supportive peers. It has been a severe mental health issue for them. It's not as if even before the pandemic the situation was good. Since we have data supporting that even before the pandemic, adolescent mental health issues were not properly addressed. But the pandemic, as COVID heads into its third year now, the burden of mental health issues in adolescents has only increased. We also recently took a look at the recent data around the same lines, and it was confirming that there has been a considerable rise in the prevalence of depression in adolescents, specifically the age group of 10 to 19 years, in the last 2 years. So if I talk about the global prevalence, then recent studies have reported that while it was around 12.5% pre-COVID, the prevalence of depression has gone up twice, up to 25.2% post-COVID. The situation hasn't been any different in India. While research has been, there have been multiple researchers studying the post-COVID effects, but one of the recent researches reveals that post-COVID it has risen to almost 53%. So, with India having the largest adolescent population, this is the latest census around January 2022, it is a matter of concern. Then we are talking about almost 130-140 million adolescents being affected by depression, which is a serious issue, which is a serious concern for the youth of our country. So this basically means that about 1 in 4 adolescents are having clinical depression. When I mean to say clinically significant depression, then I imply that it is not just sadness or moodiness or day-to-day concerns, it is depression warranting medical attention. So going on to understand what clinical depression is, it is a mood disorder affecting one's emotional state. It is characterized with disturbances in mood, activity levels, attention, concentration, and physical health concerns such as sleep issues, appetite issues, energy issues, which makes it difficult for the teen or any person being affected by depression to meet daily demands, which could be academics, which could be personal or social demands. It is also worthwhile mentioning here that depression has been commonly used interchangeably with sadness. So we have been using the word depression interchangeably with sadness nowadays. Even normal emotional mood states such as sadness can be, we talk about it in terms, we use the word depression very easily these days. But if I were to just ask you, if I were to say that sadness and depression is indeed different, and you were to take a guess at it, what could be the differences that you would uh, would like to believe that sadness is different from depression in terms of?
Sadness would be a temporary thing.
Right.
Depression would be clinical depression, so
Right.
it's a state of mind.
Exactly, right. Anyone else? Okay, so I think we have a consensus on that. Sadness is a normal human emotion, just like we have a range of emotions, happiness, anger, fear, which is, as Sir said, temporary, and we snap out of it at our will. Sadness is a part of normal range of emotion, and it is not inappropriate to experience occasional bouts of sadness, keeping in life circumstances in mind. Whereas depression is a more prolonged, pervasive, and more intense and severe form of sadness. So it is we could call it as an abnormal emotional state, which affects how you think about situations, how you perceive situations, how you act in certain situations in chronic ways. So these changes in depression last for weeks. The current criteria to diagnose a depressive symptoms is also about those symptoms need to continue for at least 2 weeks to be for a mental health practitioner to be diagnosing them. So these changes would last for about weeks, and they are more intense than occasional bouts of sadness that we observe as a part of day-to-day life. Sadness can also be triggered by a particular situation. So it is majorly a response to an external or internal event, whereas depression can occur even without a trigger. There doesn't need to be an external event triggering depression. So as a result, sadness can get better as the situation which is making you sad resolves or changes, or you get over with it. But depression may persist even long after that situation has resolved in case there has been a trigger. So another aspect specifically in terms of adolescence is that you would say that adolescents are generally very moody. You can observe them to have experienced mood swings as the onset of puberty. So it is also important to note that that moodiness need not be confused with depression. The moodiness, keeping in mind with respect to a normal phase of adolescent development, is something that the teenager might be going through on a day-to-day basis, but still the highs and lows would not be that intense or that pervasive. So if you have to look for signs of depression in an adolescent, I think we would like to look at the persistence of the mood issues, how long they persist and continue. We also want to look at the severity, the intensity with which they continue, so how far is it affecting the person's life, how deviant they are from the person's normal mood state. So if an otherwise outgoing, socially outgoing person, an extrovert teenager suddenly stops going out, talking or texting their friends, calling up friends, meeting family members for weeks altogether, then that can be taken up as a sign, as a warning sign of depression. So, coming down to the symptoms, so let's understand what broad symptoms characterize depression. To make it easy, we have categorized them into 4 broad categories. So, emotional, behavioral, physical, and cognitive, which is thought related. Emotional symptoms basically reflect as they might be outwardly apparent, so they may be covert or overt. They might be visible to you, they may not be visible to you. So the persistently sad mood, they may be irritable, grumpy. Youngsters could range from extreme sadness to withdrawal and feeling cryable and feeling upset. And on the other side, it could get to extreme irritability, anger, restlessness as well. Another emotional symptom is disinterest in previously enjoyable activities. So activities that they would enjoy earlier, such as going out to play, meeting peers or friends, they may report that they no longer feel like doing all of that. Even watching TV, for example, their favorite shows or practicing their favorite hobby can get very difficult. Another important part to note is that the experience, which may again be reported externally or not, but they experience the three important emotions that we use to diagnose depression, which is a sense of helplessness, hopelessness, and worthlessness. So they may feel useless and negative about the future. Their own perception of themselves can get very negative and critical. They may blame themselves for small mistakes which they would be able to earlier pass off as normal things. And they might feel that the future doesn't hold any hope for them, which can result in a lot of guilt, remorse, feeling a lot of unnecessary self-blame for mistakes that they should not see internally. Some of the more overt observable signs of depression would be that the mood signs would be behaviorally apparent in a lot of cryability and withdrawn behavior if the adolescent is sad, and it would result in impulsive actions, anger outbursts, picking up fights with family members or peers over small things which would not earlier anger them so much. They would, like I said, with losing interest in previously enjoyable activities, they would start avoiding those activities altogether. They may refuse to go to school, their favorite hobby classes, events, etc. This can also get extended in severe cases where they might pay less attention to their own personal hygiene, surroundings or appearance. Again, keeping in mind that that was not the issue earlier. Again, on a higher impulsivity and anger and irritability goes to an extreme end, then there can be high risk-taking behavior as well. So the adolescent could be found using drugs, driving rash, getting into accidents, leaving house impulsively, not telling family members. Obviously, these behaviors can be taken up as disobedience or anger or again adolescent rebellion. But if we look deeper into it, it could also reflect some signs of depression. There are some physical changes, so depression also results in a lot of biological concerns for the adolescent. Be it adults or adolescents, depression is associated with a lot of biological issues as well. But these issues are heightened in the case of adolescents because they are already going through a lot of changes, hormonal changes and neurobiological reorganization as a result of puberty. So during depression, commonly observed physical signs are dramatic changes in their weight and appetite. So they might be using food to feel better, to cope up with the emotional issues, or they might be eating very less. They may complain of a lot of pains and aches. So commonly reported forms of pain are stomachache and headache, or feeling dizzy or nausea. So most adolescents would first come up with these physical issues. Another important sign is a lot of lethargy. So they may report, you may observe them feeling tired and exhausted most of the time. They would prefer to lay in bed, stay in their room, even find basic everyday activities that they would do earlier. They might find those activities also very difficult to cope up with. In general, they might look very sluggish and slowed down with their activities. You might ask them to do something, they may take a long time in going ahead with it. So that sense of sluggishness and fatigue may continue in depression. Then we come down to the cognitive symptoms. Cognitive symptoms include not just the thought processes that the adolescent goes through, but also what is happening at a more biological cognitive level, which means attention and concentration. During depression, the person's concentration is highly affected, which can show up in the adolescent's case in terms of making frequent mistakes in academic work or leaving it incomplete altogether. The grades might be dropping, their ability to pay attention in classes can go down, or even the basic ability to remember things that form a part of day-to-day life, such as where they have kept their belongings, can get affected. So they may appear to be very absent-minded and forgetful. You may speak to them, but they might appear lost somewhere else, or they might be absorbed in their own thoughts during that time. So they may appear spacey or zoned out. Another important cognitive symptom is something that we call as the negative cognitive triad, which is basically having negative thoughts about self, others and future. So this forms a triad of thoughts. The adolescent starts thinking negative thoughts about their selves, that for example, I'm a failure, or I'm not good for anything, or I'm worthless. They start seeing others also very negatively. So people don't like me, no, I'm not good as other people, everyone else is better than me. These are global generalizations that they start making about themselves, others, and the future. Nothing would get better in the future. The future is bleak. There is no point of going ahead with life. So these three, the adolescent's negative perception of these three aspects grows as depressive symptoms grow. Uh, in moderate to severe cases, depression is also associated with death wishes. So it is common to find that they might engage in thoughts such as life is not purposeful anymore, there's no meaning to life. It can be very internal, so spotting suicidal thoughts or death wishes can be difficult from the outside, but what we have observed clinically or research has now documented is that there are certain signs of people who are considering suicide. So they would start voicing these concerns sometime before they are planning to commit it. So for example, they're planning to go ahead with it. So if they start talking about the purposelessness of life, or if they start hinting that, okay, suicide, I'm thinking of ending my life, or there's no point in living life, then that could be a sign and it needs to be taken seriously. In adolescence, it has also been found that they would search or read up on the internet about ways to end life, or what things like what happens after you end your life, or about death, or any such topics related to dying. They would also, since adolescence is also a period where you see a lot of philosophical questions coming up because they have now started thinking a little abstractly. So they would also start talking about death in a very philosophical way, that what is the purpose, and they might consider different philosophical perspectives that they have come across as a part of reading or searching on the internet, and they might use it to justify their thoughts about death or suicide. And they may even talk about death in a very cheerful, positive way. So that if that is happening, that indicates that they have been thinking about ending their lives. It has also been found that adolescents would, or anybody considering ending their life, would also start giving away their important or dear possessions. So they feel that as if those things which earlier held meaning for them, they no longer define their life, or there's no point in having those things anymore. So for example, teens would be giving important stuff to their siblings or friends or peers, and not find that it is a bad thing, like they would not hesitate in doing that anymore. So these are some signs which can help you see if an adolescent is having suicidal thoughts. Besides having thoughts of suicide, there can be also self-destructive behavior, or something that we call as self-harm behavior. With the increased impulsivity in some adolescents during depression, they may engage in impulsive self-harm. So it can be cutting, it can be overdosing on some kind of medication, whether they have read up on it or not. They may just try to impulsively reduce the pain of the sadness or the emotion that they are feeling by physically hurting themselves. So if any of these signs are observable, it is likely that they are going through a phase of depression. So basically, broadly speaking, through this chart we are able to see that the signs and symptoms of depression range from extreme sadness and avoidance and aloofness. So there can be an adolescent who's avoiding things and who's aloof and who's in a room restricted to a particular gadget, for example, and avoiding the outside world. Or on the other hand, there could be an adolescent who's irritable, engaging in a lot of fights with other people, getting aggressive, impulsive. It is common for people to perceive the sad and aloof, to still consider the sad and aloof adolescent as probably going through an emotional issue or being depressed. But the other ones, they are commonly mislabeled and misdiagnosed with behavioral issues or disobedience or adolescent rebelliousness or general conduct issues. So it is important to note, maybe as a parent or a friend or even as a mental health practitioner, that when we come up with any of these signs, we also need to talk and discuss historically what has been the pattern of the adolescent's thought process and emotions, to get to understand what forms the basis, what lies beneath their outward behavior and how they are acting out and expressing the symptoms of depression in case it is depression. So even though the experience of depression largely would be similar in adults or adolescents, but they differ in how they process it and they probably express it. So the differing expression, it has been found that in general adults have a better understanding of their emotions with the passage of time, and adolescents differ in their ability to express emotions. So anyways, their emotional awareness would be is expected to be is still developing during the phase of adolescence. So processing, labeling, talking about an emotional experience can be very difficult for them. So they may not come up with things like I am sad or depressed, but they may they may label it in different forms, or they might still be confused about what they are experiencing. So this follows with the second point that the teens experience greater confusion about their emotional experience. As it is, they are going through puberty, so which means that there are basic biological reasons why they feel certain emotions very intensely and severely. So it can be very difficult for them to make out that this is just a part of my normal emotionality, or whether it is actual depression or something serious or more grave. Also, research and clinical studies have now reported that when they have compared the experience of depression, the expression of depression in adolescents and adults, they have found that adolescents report greater irritability, moodiness, and impulsivity. Again, they have attributed it to puberty, whereas adults are better able to control the impulsivity. So, mostly adults have been found to express it through sadness and aloofness. Research has also reported that adolescents report more physical symptoms such as aches, pains, like we have discussed in the previous slide, whereas adults are more likely to report cognitive symptoms like the thoughts that they have, their attentional problems, for example, if they are not able to concentrate in their work, that would come up more often as compared to physical complaints. Also, as a result of the biological changes already happening in adolescents, depression in adolescents is accompanied with greater changes in their weight, appetite, and sleep patterns as compared to these fluctuations happening in adults. I'm not saying that they don't happen in adults, but the intensity is greater in adolescents. I think it is also worthwhile considering that for adolescents, their own self-awareness and their own awareness of coping strategies, how they can deal with something difficult, is still under the developing stage. They're still figuring out what works for them and what doesn't work for them. So for an adolescent to realize and to label something as depression, it can probably take a long time, and by the time they have experimented with different ways of working that emotion out, it is generally the symptoms have grown to a more severe and intense level that they are able to report these symptoms. So for adults, the coping strategies are much more well-founded, so they may come up with ways to work on their depression and seek help sooner. I think we have understood what depression is, but there are certain risk factors involved in depression. We are talking about general risk factors for adolescent adults in general, because vulnerability to depression can be greater in some cases, but if we talk specifically about adolescents, then apart from certain aspects, the risk of developing depression is almost similar for adults and adolescents in considering these factors. So all of these three factors combined or alone can make somebody vulnerable to depression. Also, it is at times an interaction of these factors that puts somebody at risk. So amongst the biological factors, genetics play an important role. It has been found that having a family history of depression puts the teenager at a greater risk of depression. Neurochemicals such as reduced levels of dopamine and serotonin have been implicated in depression. Pubertal changes associated or conditions of hormonal imbalance such as PCOD, thyroid, even nutritional deficiencies such as vitamin B12 or D3 deficiencies have also been known to put somebody at a risk of depression. There has also been found that depression is caused by seasonal variation. So sometimes depression follows a seasonal pattern with changes in exposure to sunlight. The circadian rhythm gets affected, and a person may have a tendency to feel lower and more low during winters, and the mood, activity levels, sleep pattern, everything generally improves as daylight increases and summer comes up. So apart from these biological reasons, there are psychological risk factors also which make somebody more vulnerable to depression. Amidst this, the most important is having experienced stressful life events. So these life events could be anything. It could be adjustment related issues, like for example, if there has been a change in your neighborhood or change in school. I think COVID has been a life event which falls into this category. So life events such as loss of a loved one, even death of a pet, or breakup of a relationship, or even not even a breakup, some ongoing chronic problems in a close relationship could also be perceived as stressful for a person. Going through experiences of any form of abuse or bullying also puts adolescents at a greater risk of developing depression. There have been studies which have studied childhood history of trauma and neglect, so they have also found a high correlation with later onset of depression in adolescents. It has also been found that some people have pre-existing negativistic style of thinking. So, looking at things from a, simply put, it means that looking at things, at neutral things from a previously conceived negative attitude. So, when people attribute, for example, attributing any failure to oneself, internal attribution of any negative event happening, these people would have a greater likelihood to develop depression as per research. So having self-critical beliefs or having issues which cause you to develop low self-esteem, for example, it could be bullying itself or forming a part of population which is marginalized, for example, gender identity issues or issues at school and academic performance, which affect your self-esteem. They could also put an adolescent at greater risk of developing depression. Then there are some environmental or external factors. Basically, then when we talk about environmental factors, we are considering anything outside of the person impacting them, making them more vulnerable to developing depression. So family environment, issues in the family, parental conflict, or a parent's mental health concerns, or parental substance use, alcoholism, for example, or even conflict of a parent with a sibling or with the vulnerable adolescent himself or herself, they could add up to the likelihood for that adolescent to develop depression. Financial and economic adversities have also been linked to depression. Academic pressures, growing academic pressures on performing well, on associating your identity with the grades that you have got, increasing social pressure on those aspects can also add up to the stress leading to depression. Difficulties in peer relationships, whether we put it as a part of a psychological concern or as an external concern, I think there is an overlap between the two categories here. So I think we just spoke about the common causes of depression, but since today's talk is more focusing on what has COVID added to these causes and what has COVID added to our adolescents' experience of depression, it is worthwhile to think what about COVID has caused greater depression in adolescents. So, are there any inputs that you would like to give on your perception of how COVID would have impacted an adolescent, specifically in terms of triggering depression?
Restricted movement, you stay at home,
social life.
Yeah. That can act a lot of pressure.
Right.
And then seeing such things around you, maybe other people in the family are also affected. They're also affected.
Right.
Media and the news, a big impact.
Sorry?
The media and the news.
Right, exactly.
Or seeing people dying around here.
Yeah.
I've got people saying
Right.
those are-
Right.
But
experience of
I mean,
grief.
It may be difficult for a younger person to.
Yeah, I have that.
Right. So experiences of grief and bereavement have also increased, and it can be very difficult, as you rightly said, for an adolescent to make sense of these things. So the most commonly observed, if I can put all of these things into certain points, all of them are related in one or the other way, would be that limited social support owing to social isolation has been, whether we call it restricted movement or isolation, that has been the major issue. So adolescents have reported, even as we interact with, reported that loss of peer interactions face to face, even if they have been able to reconnect with friends over the phone, over video calls, over online social media, but having their friends help for academics, like they would be able to access teachers or friends in a classroom, that has been something that they have missed out on. Similarly, there's something that we call as buffering support systems. So if my peers are my immediate support system, buffering support systems would be teachers, or for example, if I play a sport, then my coach. So if I have a concern or I need motivation, or I'm playing a sport, my coach also adds up to my mental health and my motivation and my confidence levels in explicit or implicit ways. So, and then there are older children, for example, seniors or other people whom we interact with. So they and their performance, their presence, or even just being in a corridor full of people, full of other students, all of this acts as a buffering support system, because it adds to the person's, the team's experience of the social world. So it is not just the limited social contact, it is the distance that they have had, the disadvantage that they have not been able to access these buffering support systems at all. These could not have been accessed through video calling and other Zoom meetings. So somewhere that has also impacted how they have felt their coping ability, about their coping abilities. Um, with this limited social support, I think they also had a limited access to their usual coping strategies. So if I have been an adolescent who likes to play a sport, then I don't have the access to the ground, then, or if I am somebody who takes up hobby classes or who goes for hobby classes, that has been restricted to the virtual world. So again, limiting how I experience these coping strategies. I mean, having a bad day, earlier it could be easily managed with the buffer of these activities, but post COVID that had become during COVID that had become more challenging for the adolescents. Needless to say, COVID not just impacted the adolescent but families altogether. So ranging from financial concerns to changes in living circumstances. I've had adolescents report that moving in with other family members or shifting from one city to another because of parental change of job or work from home has been a little trigger for them. It has been a trigger for a need for adjustment for them. So changing in their natural living conditions, such as even living with grandparents suddenly, or having other relatives come and live with you for extended period of time, where you are not aware when the lockdowns would lift, when people would go back to the normal living arrangements. That has also impacted. Interpersonal conflicts within the family have obviously must add to how one is dealing with their mental health issues. Also, like somebody pointed out, that with the very fear of infection itself and health concerns befalling family members, elderly members, oneself, and wondering about the resources one has to manage it as an adolescent, as a still not an adult but a growing up person, can be difficult. Even if there have been any deaths in the family, so understanding that and going through experiences of grief and bereavement can be very complicated for an adolescent. There was an obvious disruption of routines. In fact, most of the studies in mental health that we look up, they mention that the lack of routine was a major contributor to adolescent mental health issues. Even if academic classes were ongoing online, but there was a extended disruption in how one perceives online classes, how one goes to school. So there has been a difficult adjustment through that change. It also resulted in increased boredom. It is needless to say that that increased their dependence on gadgets and media and other virtual resources, which is again a substantial change in their routine. Needless to say, there has been COVID has been experienced as a period of an extended uncertainty for all of us. But adolescents who are already in a process of making sense about themselves, about the world, uncertainty can be a little more triggering than that for an adult. So, uncertainty about school schedules, for example, when will my school open, how will my exams be taken, whether I'll be able to perform well in an online exam, whether even when schools were reopening, then after a gap of 2 years, going in, physically being present in the school, taking an exam in the paper pencil mode again, those aspects were reported to be quite challenging by adolescents themselves. The history and the incidence of panic attacks, for example, increased in the classroom after the schools reopened. So many schools reported that they had to have school counselors coming in for the students' rescue, because the whole experience of again being in a classroom and taking the test was very overwhelming for some children. So again, another aspect of uncertainty that was noted was that some children who had who had a better clarity of what they want from the coming years, or who were looking for example, college to start, or personality development through school exposure, or looking for opportunities to build up their career or their resume, or in any sense of development. They felt a sense of missing out. So they were very uncertain and very scared about how am I going to get all of these things again. So, for example, for a socially anxious person looking for school as an opportunity to mingle with other people, to gradually come out of their social anxiety, being forced to not have that exposure again and be restricted to the household could be seen as a sense of missing out. So something that we commonly now call as fear of missing out. So the sense of fear of missing out increased with this uncertainty and loss of opportunities. It is also worthwhile noting that students or adolescents with pre-existing mental health conditions were also affected even worse. So there have been studies which report that teens who were on the verge of developing a mental health issue, for example, who just recently before the lockdown experienced an episode of abuse or bullying, they were left in the middle, that they did not know how they are going to handle the coming days and with their mental health concern. So, and somebody with a pre-existing mental health condition, it could be ADHD, it could be eating disorders, it could be depression itself, or other anxiety issues. So they are already, their demands of coping are already high. So with the COVID happening, with COVID coming in, with the pandemic happening, those demands to cope with day-to-day activities and day-to-day life stressors increased, adding to their mental health concerns. Obviously, another aspect for them was that how would their mental health treatment continue? Initially, that was difficult to figure out, with a lot of people losing out on the mental health care support that they were receiving, not being able to connect with hospitals, the OPD sessions that they were used to having. So when initially online supports weren't available, that also added to a lot of uncertainty and a sense of not knowing where their health is headed. So I think irrespective of COVID, with COVID or without COVID, the treatment of depression remains the same, but the severity of when we talk about depression, then treating depression, then we keep in mind two things. So basically, considering what is the severity of the depression based on the mental health practitioner's history taking, their assessment, it is determined whether what kind of approach, what kind of a modality of treatment they would use, and whether what kind of setting would be required. By setting I mean, would it be an inpatient setting, very severe forms of depression with a risk of self-harm or suicide, would need to be managed under supervision in an IPD setting, which means they would need to be admitted. But other forms, mild to moderate forms of depression, can be managed, or even severe depression without the risk of suicide or self-harm can be managed on OPD basis. So it is also important to note that early onset of depression, such as in adolescents, is reported to be associated with greater future recurrences. So untreated depression in the first episode and early onset of depression is associated with greater likelihood of future episodes. So, and obviously it is an impact on the youth's developing aspects. There are personal, social, academic considerations to be made at this age. So untreated depression can affect all of those decisions for the adolescent. So it basically comes down to the fact that early recognition and early intervention is associated with a better outcome in cases of adolescents, definitely with adults, but more so for adolescents. So there are two broad approaches that we commonly take to the treatment of depression. First being medication. As we have discussed, there are biological causes to depression. The antidepressant medication that we use prescribed by psychiatrists, they work on the neurochemical imbalances addressing the biochemical issues of depression.
Serotonin suppressing something, right?
Right, so this is selective serotonin reuptake inhibitors. So since I mentioned that there is a decrease in the amount of serotonin, so there are various ways in which serotonin is not available in the required capacity. So these medications work on reducing that excessive consumption of serotonin. So they make more serotonin available for the brain, and which adds up to the emotional balance and regulation.
Selective serotonin uptake.
Reuptake inhibitors. So reuptake basically means that serotonin is getting used up by other channels in a more increased way. So that is managed by SSRIs. There has been a lot of research on medication, and I know there is a stigma around medication, and there is a reluctance to put a teen and adolescent on medication. But like I said, a mental health practitioner would be making that decision considering the severity and the need. So we need to go with a little bit of trust on that. And secondly, we have a wide range of medication available now. Earlier, maybe 10 to 20 years earlier, medication available for depression was very limited and had adverse side effects. But fortunately, depression has been one of the most researched mental health issues, which has led to a good development of a research base for the least harmful medication, the safest medications that could go on with the normal biological changes of the teen, not affecting their other development, and simultaneously address depression and anxiety of the adolescent.
What is the success rate? I mean, one hears about side effects, there's a cost, the benefit.
Right.
I mean, at macro level, not for one person, but let's say 100 patients. This is something I never hear about. What is the success rate? People talk about side effects, is that
right. Like you said, the assessment is based on the cost-benefit analysis. Right? If I see that the symptoms are beyond
I'm not
control.
saying for an individual person. I'm saying these medicines.
Right.
Okay. Individual ko cure karega, nahi karega that. But I say you treating 100%, 100 patients.
Then you know some pattern, statistically.
So what is the success rate?
I would not be able to quote a specific number since I haven't gone through it.
I'm not asking you for. I'm not going to pin down. I mean,
yes,
10%.
but
I mean, 90% success rate.
Yes.
Let's say if I take a aspirin.
Right.
90% of people will say, yeah, the headache goes away.
Right.
So that's fine. So then the side effects are
right.
minor.
Right.
So here, what would be the numbers?
So it is definitely these two modes of treatment, like I have just told, they are epidemiologically and research-based recommended treatment guidelines. So we have treatment guidelines for treating any disorder which is based on solid research and effect of the particular medication.
It's all very well funded and well done.
Right. So the treatment guidelines for adolescent depression suggest that for the cases of moderate to severe depression, medication is the first line of treatment alongside therapy. What research has studied is whether medication alone psychotherapy alone or combination of medication and psychotherapy is beneficial. So they have found that a combination of medication and psychotherapy is much more beneficial for an adolescent. As to answer your question, since I'm not able to quote a specific research right now, but out of clinical experience, what I can say is that I would have seen more than 90% success rate for medication. Even still, there are cases where, like, if you are reluctant to take up medication, or it is your personal choice to wait until you have tried other things like therapy. Even in those cases, we first give a trial of 4 to 6 weeks of therapy, psychotherapy with the client, and then if we see that things are not improving or declining, or some physical symptoms are biological concerns are interfering with the progress, then we do recommend to go ahead with medication.
I tell you where I'm coming from. I know some patients with suffering from this, adolescents as well as adults. And they all taken medication and it doesn't seem to have worked.
Okay.
So that's where I'm coming from.
Right.
There's not a problem of side effects, but it was not
Doesn't work.
Yeah.
Right. So there are categories of depression wherein medication or a certain line or class of medication doesn't work. There is also treatment-resistant depression. So there is that category where any kind of medication, pharmacological or psychotherapeutic treatment, given sufficient trial. Again, we call it treatment-resistant after having gone through the stages recommended treatment guidelines and for a particular course of time. Even after going through that protocol, if things have not improved, then it is considered to be treatment-resistant depression. Beyond medication, there are newer age.
What do you do about treatment-resistant depression?
Sorry?
You said then consider treatment-resistant
Right.
depression. What do you do about those?
I think then there are other forms of treatment. There is ECT, so electroconvulsive therapy. Right?
Those are more radical.
More radical, as you may call it. And then there are recent advancements,
Lobotomy.
rTMS. rTMS is another, I think, rTMS as well as TDCS we have, right?
Lobotomy also, right?
Sorry?
Lobotomy.
I am not aware if lobotomy is practiced for depression. Lobotomy is contraindicated for depression. First, we go ahead with ECT in those cases with very severe vegetative depression, showing no response to any medication or therapy, or with extremely severe suicide attempts.
Then ECT would be your...
ECT is the go-to treatment, right? And then we have these newer age other techniques also, which are still under research, which is rTMS, magnetic resonance, and TDCS as well.
And is rTMS harmful for the brain because you're putting magnetic waves into the brain?
No, again, ma'am, we are talking about cost to benefit here.
I mean, a simple MRI.
Again, वो भी है, but the technique is very different. Choice to go for rTMS is based considering whether all my other milder options, safer options have been ruled out.
I know a doctor, he prescribed rTMS as a first choice.
Okay.
So I don't think doctors are ethical here.
Well, then I think it goes with practice. So well, all in all, this decision is made considering a lot of other options, given the age, the circumstances, again, your own preference, the family support available to the adolescent. If we feel that the support is good and other risks are low, then we might just recommend for some psychotherapy sessions. So we won't go for medication. So again, the decision is again taken with a lot of thought put into it, since it is an adolescent with a developing, with a lot of concerns right now. So in terms of therapy, we usually take two modes, which is cognitive behavioral therapy. You might have understood about it in the last session as well. And another research-backed form of therapy. It is a short-term, very intensive therapy, interpersonal psychotherapy. It is basically aims at resolving interpersonal conflicts. So it has been found very, very effective for adolescents because most of adolescents' concerns and mood issues revolve around interpersonal relationships. So research has shown good results, and it is time limited. It is 12 to 16 sessions and has a very specific format. Interpersonal therapy.
I thought all cognitive therapy is...
Cognitive therapies are, yes, more mainly, but again a range of 16 to 18 sessions, which can even be 24 sessions in some cases. So this is more short term.
And one session would be what, an hour?
50 to 60 minutes. Right. So they have specific guidelines that they have to have 2 sessions a week of interpersonal therapy, and it goes in a different way. Goals are different. The time limitedness is, as you said, common to all these therapies. So noticing that if as an adolescent we notice we have met the criteria for depression, or we do recognize the signs of depression, I think first anybody noticing that would feel a little confused and overwhelmed. So the most important first step becomes to give it some time to sink in, to acknowledge, and to not be worried about it. I think we need to understand and have this hope that depression or any kind of intense emotion colors our perception of our experiences and things that are happening around us and within us. So maybe when we come out of this emotional state, then our perception of that situation around us will also change. So that becomes more of a reason to give it time. Hence, we should also delay any important decision making at that moment, since you are considering things from a very pessimistic, negative perspective. It is important to not take any important decisions. Could be about changing school, could be about even self-harm or considering death, or it could be about anything, moving out of the house or making some substantial changes to your living situation or with family or things like that. So as much as possible, delay any impulsive decision making, or have a friend talk you out of it. If you trust them, just tell them that you want to be talked out of it. So whatever they can help to add to that. I think it is also important that naturally with depression we disconnect. So it is important to stay connected with a trusted, safe source. We also see a pattern that instead adolescents move from trusted, safe sources to unsafe sources over the internet, where there are anonymous chat groups or other places where they are more comfortable sharing what they are going through, which could be healthy as a if done from a point of emotional expression and ventilation, but it will not get you the extended support that you probably need for coming out of that phase. So choosing a healthy source of communication, could be parents, could be a friend, could be anybody, is very essential to starting off to figure out what is wrong with you and how you can come out of it. As I said, expressing your emotions through any means, whether it is through an intensive exercise or it is through art or music, that you can
be slamming doors.
right, until it harms anybody. Anything through which you can just ventilate your emotions, talking, listening to music.
This can help.
Right. Well, certain genre of music, if you are able to relate, certain kind of things that you are through art, through any such thing, just you need to ventilate, so that it makes it easier for the adolescent to make sense when it is out. So if it is out there, then what I said earlier, that labeling the emotion becomes easier, that what I'm going through is this, it looks like sadness, it looks like anger, whatever it is. So it is also important to maintain a basic schedule, I think, which we struggle with most adolescents. So a greater emphasis on maintaining a good sleep schedule, at least a basic time to sleep. It can be flexible in terms of half an hour here and there, but broadly not varying from 12 one day to 4 the other day. And I think we need to refrain from addictive substances, because with the initial release or with the initial relief associated with them, they are also associated with a very bad fallback. They interfere with the biological, again, dopamine and serotonin. They interfere with the normal processing of these neurochemicals. So they could be making things worse. Also, they would add to the second point, they would go against the second point, that they would add to impulsive decision making. Getting exercise is a natural antidepressant. I think that's something that we all have been hearing for a long time, but difficult to practice. So what we suggest is that starting off with 10 minutes of basic walking or anything within your house, or any kind of movement 3 times a day, that could be a good start, and then increasing it to 15 minutes for 5 days altogether, then 20 minutes for 5 days a week, something of that sort. ensure that exercise here doesn't really mean very hard hitting, proper gymming kind of an exercise. It could be just a walk in the nature, outdoors, in your balcony, on your terrace. It could be yoga, it could be just any kind of a physical movement. I think we learned about some relaxation strategies in the last discussion. So, depression is often associated with some bouts of anxiety also, or even just going through a very overwhelming bout of crying. After or during a bout of crying, you could feel breathless and you could have an anxiety attack simultaneously. So in those cases, we recommend practicing some relaxation strategies, diaphragmatic breathing, any sort of breathing exercise which helps regularize your breathing pattern is recommended. Beyond these things, I think if we have to go one step further as a self-help, this is cognitive behavior therapy in a very nutshell kind of a thing. We might not be able to be very successful doing it with ourselves, but worth giving a try. So it is important to note that negative thoughts automatically come up during depression, and they almost act like a magnet. So it is like one thought just attracts other negative thoughts from the past, from the present, about the future, and what we started off initially as a small thought has grown in its side, has snowballed into a lot of worries, a lot of negativity, and the negative cognitive triad that we talked about. So it is important to break this cycle of negative thoughts as early as possible and to snap out of it. Snapping out of it would require you to distract yourself sometimes. Know that you could practice grounding techniques which have been discussed in the previous session, or just basic distraction through your senses, doing something, engaging your senses elsewhere could help you distract. Once that has happened, then it helps to stay occupied so that you are spending least amount of time occupied in these thoughts. So planning some activities for a particular day or at least 2 days, like for today and tomorrow, could be helpful. When you plan some activities, it doesn't need to be an hour by hour thing. You can just give it a few minutes here and there, and just 2 activities in a day, and including 1 or 2 things that you usually earlier used to enjoy, something which includes a physical activity, something with another person, a social activity, something that makes you feel better would be good. So if you are not able to do it yourself, then seek support, encouragement, push from somebody else. Then it could be a good idea to journal, make a thought diary, putting down your thoughts, start putting down whatever is coming through your mind. Need not be a depressive thought, it could be just anything. So put it down in terms of what is the situation where you had those thoughts, what are the feelings that you were experiencing, what were the thoughts going through your mind at that time, and how did you deal with that situation, what was your behavioral, physical response to it, did you go away, did you engage in a conversation, what did you do? Once that record is available, it is also important that we not just snap out of the thought process, but we also question these thoughts, because as we noted earlier, depression colors our thought process, so questioning these thoughts would be a good idea. If you have to question and challenge these negative thoughts by yourself, you could start on these lines. You could first ask yourself that, what is the evidence for and against this thought that I am recurrently having? Is there any other way of looking at this situation? What would I suggest a friend? Maybe I am biased in looking at it, so taking distance from the thought process, from the problem can help. And I sure feel helpless, so what can I do about it with my current resources? What is within my control? I think we learned about having control and, looking at things which are within our control as a way to boost your coping abilities. So if all else fails, then definitely go and seek professional help. Needless to say, even after all of this or with all of this, you could still benefit a lot more by talking to a psychiatrist or a clinical psychologist. We have a short discussion about what can parents do to support their adolescents' mental health. I think the first step, needless to say, would be, which is why we are here, to understand about depression, how teenagers or adolescents specifically experience depression, and how to note the signs. Once you do pick up the signs and you do recognize that your adolescent child is going through these symptoms, then it is important to start a conversation. A big issue is that we hesitate and we wait. We feel that they might come up to us or it would get awkward. And a bigger worry is that what if they are not depressed and I am planting this idea into their head, right? So it is clinically recommended that please go and have a conversation as early as possible whenever you are sure that these signs are long lasting and pervasive. Now, if you would ask me how to start that conversation, then it is important to have the conversation when you are calm, you are not worried, you are not angry, and you can have a attentive conversation. Start with telling them about what you have noticed, which is amiss, in their behavior, that you have been acting like this or that, or I have observed that you do this, and that the fact that they worry you, that you are worried about these changes in their behavior. Then you could go on asking them, if they are comfortable with sharing. So if they are able to talk about it, give it some time, let them open up, ask more open-ended questions in the sense that what happened, why, how could you, what are you experiencing, what is it that is making you feel this way, right? Be willing to truly listen to them, because the first few conversations will form the base for the future conversations. So your initial reaction means a lot to the adolescent themselves. So you telling them prematurely that ये तो बहुत छोटी सी बात है, या this is not something big, या when I was your age this was nothing, something of that sort, can close it for them forever. So, attentively listen for the first few conversations, for the first few dialogues, so that you are able to help convey the sense that we are here and we are here to listen to you, and no matter whatever you are experiencing, we understand that that could be something you are going through, even if I don't relate with it. So, as a strategy, we recommend that when you are going to have that conversation with your child, if you have thought about a lot of things, then speak half of it. That in the first few conversations, whatever you have planned on talking, speak half of it and focus more on listening. Even if your perspective of the problems is different, you must resist any urge to criticize or pass any kind of judgment prematurely. Like I said, you want to communicate that you are there and you want to help them in whichever way possible. So this would help them trust you better. Sometimes another issue with adolescents is that they would not open up very easily, and they would not, your initial first few conversations, they may even shut you out completely or be rebellious or be angry at you asking these questions. So you would need to be gentle but persistent. They may take a long time talking about it. Like I said, they may themselves have not figured it out, so it can be quite puzzling and confusing, and they may have a hard time expressing what they are feeling. So convey that we are there and we are waiting when you feel like opening up, and we would like to listen to it in an unbiased way. So you might need to work on your own patience during the conversation. There can be times things can be said which anger you. Maybe something about you is said which makes you impatient, angry, or makes you deny the points that your teenager is giving you. So take a few deep breaths during the conversation, hold back as much as possible, be prepared to be patient throughout the conversation. And the most important part is that adolescents are themselves very confused about what is happening, and mostly they are looking for an answer that what I'm going through is not something very weird, or am I weird if I'm going through this? That's the basic assumption that most adolescents would be having. So they want an external validation to their feelings that okay, this is something worrisome, or this is not something worrisome. So with the initial conversation, if you are able to convey things like, okay, I'm able to understand how you are feeling like this, or how you are so stressed about it. Even if you don't agree with the intensity of stress or sadness that they are expressing over the issue, just understanding that somebody in their shoes could be experiencing it, right? And with COVID, we understand that this has been a genuine concern, that adolescents would have some mental health issues. So making it apparent and accepting, easy to accept that yes, they could have a mental health issue if they are experiencing something, or an emotional issue if they are experiencing something, can be of a great relief for them. So basically they are upset as well as scared. So reassuring them and acknowledging and validating that it is okay what you are going through, and I understand you are scared about it, but let's try to work it out, would be a great thing to work with. And then finally, I think checking with them what they want to do about it would be the first idea. Instead of suggesting taking over the mantle on your own, they don't want to be patronized. They don't want to be told what to do. So not going that direction. I think just for the first few conversations, asking them, okay, this is there and we need to do something about it. What do you think you want to try out first with? They may want to just talk to you, keep talking to you to ventilate. They may say that मैं अपने आप handle कर लूँगी या कर लूँगा या मुझे आपकी help नहीं चाहिए. Or they may come up to you yes that and ask कि ठीक है आप मुझे कोई doctor से consult करवाइए. So they would express what they want to do, and you can go ahead and give that a shot. If you feel that has also not been working out, then you would have to have the conversation again. That listen, we have given it this much time. I don't think it's helping. Then I think this is the route out. Do you think we can give this a try, a chance now? So this would result in a constant back and forth of checking how they're doing. So lastly, I think it is understandable that they need a lot of support with skills. With pandemic coming in, their usual skills have gotten reduced. So you may want to extend more help with them. For example, social skills, if they're navigating through a tough friendship, you will need to talk to them through the stages of how you can go about resolving a problem, much more than you would have needed 2 years ago. So their exposure to things have gone down. So they may be clueless about working certain things out, which they were adept at working out earlier. So they basically need more help from you. They would also need more academic help, more help and support in the sense of managing their moods and maintaining an atmosphere of warmth, predictability and comfort, avoiding conflictual discussions at home. Family conflict is also essential for them to feel in control and secure at home. Also, needless to say, as a parent, you must also be worried about yourself, your child's well-being. So managing your own anxiety and your own worries about your child's well-being also requires attention. So taking care of yourself, you should talk to your partner or any trusted friend, a friend who has a child of the same age, getting any kind of support for yourself, or if even you feel you are also very disturbed by your child's situation, then getting professional support for yourself would also be recommended. Keeping up your hobbies, your activities, taking some time out would also be necessary, since this is not going to be a 2-day thing. It is going to be something that you need to be involved with your child for a longer period of time. So you need to maintain your resources as well. So I think this brings us to the end of today's discussion. Depression is a very wide topic. I've tried to cover the basics of it as much as possible